My name's David Shorthouse. My background is I'm an engineer, and I've had quite an interesting career. I've always chased interesting problems. So I've spent 15 years in the finance arena, derivatives and insurance. And most recently, I'm just moved into blockchain. So I've just joined Guardtime. So I hopefully can answer most of your questions, but if I can't answer them, I know someone who can. There's some very bright people in Estonia. I'm going to talk about a usage case of blockchain in the healthcare system that's live, been running for 7 years in Estonia. Firstly, a bit about Guardtime. We're the world's largest blockchain company. Started in 2007 in Estonia, in Tallinn. Lots of big partnerships, 150 employees, growing fast and getting bigger all the time. There's an enormous amount of blockchain applications out there. We've had our own blockchain stack running since 2007, used by governments, used by major corporations. Just recently we had a contract with the US military, combination of locking down software and hardware for their fighter jet program. Essentially, if you think about anything as a bunch of data, any data can be stolen, can be replicated, can be changed. So the way we view blockchain usage is we can lock in that data, we can provide integrity for it, so you know if anyone's touched it. So these days, if someone writes some software for a fighter jet coming from anywhere in the world, we can prove that hasn't changed. Now, Estonia has a fascinating history. So I'll give you a little bit of background. It was given independence from the Soviet Union in 1991. It didn't have very much money, didn't have much industry. Started a new government. If you take a look at the symbol of the eagle, it's actually looking east rather than west. So it's the only eagle emblem in the world that's worried about the country to their right. In 2007, Russia actually instigated a state-sponsored cyber attack against the Estonian government. And it was then that they got serious about cryptography. They realized that one of their big assets was they had a bunch of very clever cryptographers, some strong universities, and they set off on a project to come up with a government that could completely be impervious from cyber attack, and they didn't have much money to do it. They have succeeded, and I'll go into that in a little way, and now the headquarters of NATO, in terms of their anti-cyber base, is based in Estonia. Coming to the end, what have they done? They've put everything online. All the government institutions are online. They basically took a blank piece of paper and said, how are we going to do this? And which is a nice way to start. And every citizen has a card, and I'll come into that. He can do everything online, bank online, taxes online. They'll tell you in 3 minutes how much tax you have to pay. 99% of state services are online. One of their guiding principles was that user data was owned by the users, the people, the voters. It should only be stored once and in the right place. So medical data should be stored in the medical systems, tax data stored in the finance systems, and so on. And they did it on a very low budget. I mean, Estonia, the spend on IT is 200 times smaller than the UK, and it all works. So there's an enormous amount of efficiency that's gone into the Estonian design systems. This 2% comes from the Estonian government. They reckon the fact that they've transformed their society to a digital society means they've saved 2% a year of GDP. And that's an awful lot of money. And that's ignoring any costs due to fraud or other illegalities. So what did they do? They stood back and said, we want a data model that works. So we want to ensure confidentiality of citizens' data. So we just touched upon hospitals selling off people's data to companies. They want availability. They want all the citizens to be able to access their data, and we'll come to that. They use something called a crossroad. And they want integrity. You know, they don't want the data being adjusted. They don't want it going missing. They don't want anyone accessing it without their permission. So that was their goal back in 2007. They did the same thing to all their government systems, but I'll look in particular at the Estonian healthcare system. Interesting point, again, commonly quoted figure, $272 billion lost in the US to healthcare fraud every year. A massive, massive number. And there's an awful lot of money swirling around the private healthcare system. In Estonia, they reckon it's zero. This is a government schematic of how they look at their whole digital-based systems. The blobs at the top are essentially the different government entities, but each of them have their own database. And they can all talk to each other on something they call the crossroad. It's not really a bus or a road, it's actually like a VPN. It's very well secured. Each institution can talk to another institution. The main thing to note is the little red circles here. These are the use of Guardtime blockchain. What Guardtime has done is basically monitor and lock down every activity in the database. So what it means is the data that's in there can be proved to be the same data that comes out. We can track, it is tracked everybody who looks at the data. That goes in as a database record, and that's all added to the blockchain. So at the moment, this is all working. It's been working for several years, and the Estonian government has everything on the blockchain. Complete transparency. All government spending is all available to every citizen of Estonia, if they know where to look. So just to reiterate, because of the use of the blockchain, and I'll go into it in a little bit in detail in a moment, basically every patient, they can be 100% certain of the accuracy of their medical data. They can see it, they know if it's changed, and they know when it's changed and who by. They know it's complete and truthful. We touched on the concept of trust. This sort of goes hand in hand with integrity. And this is really what the blockchain can give you. We tend to look as the blockchain as giving integrity to any bunch of data. Yeah, so you can imagine why it's such an exciting area for us, because almost everything is data at the end of the day. So if you remember, initially they wanted three things to work in their digital government. First bit was confidentiality. Every citizen of Estonia has an identity card. It's actually got a small chip on it. It contains 2 certificates. I think Robert mentioned PKI encryption technology. That's all built into the identity card. It's also in their mobile phones. All their mobile phones have two certificates on them, so they can actually talk to the government systems through their government phone, through their mobile phone. Availability, that was the crossroad diagram I showed you. That's all online. You can log into your e-health system, and I'll show you how that looks. You can log into your tax system. Government is completely transparent. And the final bit was the integrity. This is where the Guardtime blockchain comes in. We can prove that nothing's changed in the system. We can prove the timing of every event, and we could prove the data hasn't changed. Big success for Estonia, and a wonderful model for the rest of the world to follow, you would think. Interesting story here. I understand that the Estonians got very excited about this and presented it to the EU. Said, look, a lot of money's lost in the common agricultural policy. Why doesn't the EU move to this system? And interestingly enough, I understand the Italians and the French took them to court to block introduction of this technology into the EU. So again, I think it comes back to will. Where there's a will, there's a way. Quick little dive into what do we do. There's many variants of blockchain. I think Robert gave a very good introduction to the Bitcoin blockchain. Entries are allowed to the blockchain through proof of work concept. There's also other ways that people are working on to allow a trusted addition to the blockchain that fall under the title of consensus algorithms, which is one we use, because we very much thought, well, the applications we saw, we need speed and scale. So our blockchain, we can add another entry every second, and it's been going on since for the last 7 years, and it's actually very efficient in size. We don't actually store data in our blockchain, we store a hash to the data. Now, we touched very briefly on hashes. Hashes are, if you like, one of these one-way functions. So you can take a digitized book, you can take a digitized database, and you can produce a hash of it, which always has the same length, which can be almost guaranteed to be unique. So if you like, it's a fingerprint. So what you can say is, that bit of data has that fingerprint. Another bit of data I know doesn't have that fingerprint. So I can always prove in a very efficient manner that the original source of data was the same. So we basically add hashes to our blockchain in a way that we can scale very quickly. And the benefit that Robert touched on is that the numbers in our blockchain, because we lock it down and do it in a way that can't be attacked, can be trusted. And so the results coming from the blockchain can be trusted. Here's a pictogram of essentially what's going on in the healthcare database in Estonia. Now, everybody's on here, their database. Every pharmacy, every hospital, every doctor, it's all in one place, which is important. I think we touched on that. As you can imagine, there's an awful lot of database records going on. Every access to the database record is recorded. Everyone has their own unique ID with the ID card. Now, what happens, we use a clever algorithm. That means we don't have to store a blockchain record per database edition, but we combine them all together to come up with a hash, and we add one hash every second to our blockchain. So the interesting thing about that, it grows linearly in time, our blockchain. It doesn't actually grow in proportion to activity, which means it's very manageable, for the next decades. The other thing we touched on is there's an audit log. Audit log checks who's looking at who, and also that goes into the blockchain. So no one can look at the data without it going on the record. That audit log is updated as an entry on the blockchain every 2 seconds. So you talk to the average Estonian citizen, and they don't understand why the rest of the world's not doing this. It's normal for them to own their data. They give permission as to who can see their data. Here are some examples of the eHealth portal. I mean, we've made up the names, obviously, because the data is private. But basically, you log on using your card, you have a couple of passcodes, and that's your proof of who you are, or even your mobile phone. In this case, we come into the eHealth permissions portal, and here you can actually give anybody permission, or more importantly, take away permission to look at your records. So for instance, there's some entries on the right saying, I've unlocked it for a particular doctor. If you don't like a pharmacist, you can lock them out. So it really is power to the people. By default, they're all open, because you trust the hospitals and your doctor, but you can shut them down. It's all your data. And as I mentioned, there is some very heavy-hitting EU regulation coming in that's going live next year, where everybody in the EU has that right. And also anybody handling their data over the rest of the world is affected by the regulation. So the Americans are sitting up and taking notice of it. Again, this is the eHealth portal in Estonia. This is for prescriptions. You can actually look and see your whole history of prescriptions. You can actually pull down your medical records. You can even see what prescriptions you've got active that you haven't taken down. Now, this is all coming from that database. It's because the government had the insight to put everything in one place and made sure that people trusted it because there's the blockchain all behind it. Finally, this is the logbook. This is basically, you can look to see all activities here. Anyone who's ever accessed your medical records, you can list it out, list it between dates. So as you can see, the citizens of Estonia have complete control over their medical data. And soon, every EU citizen will have that same right. But what made it happen, I think we touched on, it was basically the government having a clean piece of paper, not much money, but the will to make it happen, from the top down. And because it's data, and they wanted integrity and trust, it was a wonderful application for blockchain technology to get involved in. I think I'll leave it there because we can always follow up. But Guardtime it's on the internet, guardtime.com, if you want to learn any more, and I'm happy to answer any questions.